Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
If it's more than a centimeter and it's all the way through, usually we have to go in there surgically, but we can repair it with stitches. We can put stitches across there, and it's got a good 80 to 90% chance of healing. Now, if we're doing an ACL at the same time, it has an even higher rate of healing because we're stimulating more of a healing response. And if we add regenerative medicine techniques like bone marrow, which has stem cells and other cells to help the stem cells, PRP, platelet-rich plasma, which has growth factors, kind of like Miracle-Gro, laser, which increases blood flow, all those things can help increase the rate of healing. Now, if it's torn along the junction between the inner two-thirds and the outer, it still has a pretty good chance of healing. We call that, this is the red zone, meaning there's a lot of blood vessels there. The red-white zone is the junction between where the blood vessels are and no blood vessels. And if we suture that, sometimes these blood vessels will grow back in there and it'll heal. However, if it's in the completely white zone where there's no blood vessels, like in here, you can put all the stitches in the world. It's probably not going to heal, especially as you get older. If you're younger in your teens, maybe you still got a shot because you have a better blood supply. If you have a tear that goes completely across here, called a radial tear, that's a problem. Those are very difficult to get to heal. Maybe you can get this part to heal, but the part in the white area is very difficult to get to heal. So sometimes we got to trim out part. We call that a partial meniscectomy and repair the rest. If it's a piece that's shredded or like this piece tears and it's flopping back and forth, locking your knee up, and it's what we call a flap tear, sometimes you just have to trim that out and take it out. But we try to preserve as much as we can because, again, it's your main shock absorber. If it's torn completely across here, it's going to gap open just like on a barrel. You know, when you have those rings around a barrel, and if you snip that band around the barrel, it's going to pop open and it's not going to provide any support. So if you have a radial tear, that's like snipping that band around the barrel. If you just strip some of this out and you still have what we call the hoop strength, the hoop around the barrel, if you just strip the upper thirds or 2/3 of a hoop around a barrel, but you still have the lower third or part of it still there, it's still going to hold. So we call it hoop strength as well, is what we call it. And if it's cut all the way across, what we call a radial tear, you lose all your hoop strength and you lose the function of the meniscus. So those are really bad tears to have. So we're pretty aggressive nowadays, really trying to repair as many tears as we can, trying to add regenerative medicine techniques to improve the healing rate. Rehab protocols are much better, as you know, to try to get these things to heal. Because once you lose it, we don't have any way of growing this back. It's going to take a good 8 weeks to get that thing to heal, and then it's going to take 3 or 4 months to get back to full duty activities after a repair. And you're going to be limited with a brace for a while, 6 to 8 weeks, 4 to 8 weeks, depends on the tear. So there are limitations, and it still might not heal.